had immunity?
Usually that's going to take approximately 2 to 4 weeks. So it's very, very important, get your vaccination. There's going to be very, very little complications from that. And I think at this particular time, and we know that it's important to get the vaccination because we can stop this disease.
What about adults? People who aren't sure that they were vaccinated, they weren't sure whether they had 1 dose or 2, or somebody who thinks maybe they had the disease but as a child, but they're not sure. For the adult population, what do you recommend?
I recommend that they go see their primary care provider and talk about it with their primary care provider. But let me say this. If you're not sure and you're an adult, you can get the measles vaccine. It will not hurt. So if you're not clear and you're not sure and you don't remember, you can have the measles vaccine also.
We know from some other localities that there were some people in the Orthodox Jewish community who were not getting their kids vaccinated. No known religious objection to it, just not getting it done, maybe fear of side effects. What do you want people to know about getting the shot for young kids?
Measles vaccines are extraordinarily safe, and it is very protective against these particular diseases. So I say to each and every one of your viewers, I say to the entire Baltimore County, the state, and also the United States, get the vaccine. It is very, very safe.
What do you see as the barriers to getting better compliance with vaccines? I understand that it's free, whether you get it through your health insurance or through some sort of clinic.
Well, you know, we have a very, very high uptake rate in Maryland. Over 97% of the people get their vaccines. So at this particular time, we're just kind of saying to everybody, if you think you possibly might be under-immunized, please, please, please go out and get the vaccine. But we're doing very, very well in Baltimore County and in the state when it comes to people taking the vaccine. But I can tell you that we're going to have a vaccine clinic, and I have it right here in my hand, at the Bosch Yakov School for Girls at 6302 Smith Avenue on Wednesday, May 1st. And that's going to be from 6 to 8 p.m. Again, that's going to be Wednesday, May 1st, 6 to 8 p.m. at the Bosch Yakov School for Girls, 6302 Smith Avenue, Baltimore, Maryland. And if you think that you don't remember or you think you would like to have a vaccine, come on out, show up, and we'll have some physicians there and we'll talk to you about that.
Are there ever any reasons not to get the shot? Or are there contraindications, as you say?
Sometimes people have had allergic reactions to vaccines, and you'll know if that's you or not. So because of those types of things, we will say to a family, you should not get that vaccine for that particular child. However, that is very, very, very rare. And so we're going to say to you that everybody should get the vaccine.
Especially folks who are considering travel this summer. We know some other parts of the world, measles much more prevalent. It's not a souvenir you want to bring back.
Exactly. And if you know that you're going to an area that has been impacted by the measles, then you should get your vaccine. And like we said before, you need to get it approximately 2 to 3 weeks beforehand because it's going to take that much time for you to become immune.
Very good. Dr. Gregory Branch, the health officer for Baltimore County. Thank you very much. Coming up tonight, what you need to know about advanced directives. That's next as Direct Connection continues.
Got an unused vehicle going nowhere? Donate it to the one place that can take you any place. Visit mpt.org/vehicles and support the programs you love on MPT.
The MPT app puts our programs right at your fingertips, so you can choose when to watch, what to watch, wherever you want to watch it. Download it now.
Are you turning 70 and a half this year? If so, you generally have to start spending down your retirement account. Even the minimum distribution can place you in a sticky situation. Luckily, you can now use your IRA to make tax-free gifts. Gifts up to $100,000 will never count as income, but always make a difference. That's icing on the cake.
Make your gift for this year before December 31st. Visit mpt.org/support.
This is a box that showed you a world beyond your own. It was just a box, but the world has changed, and so have we. And now the box can be almost any size or shape. And you decide what you want to explore. Anytime, any place. Break out of the box with PBS.
For our Your Health segment this week, we're joined by Dr. Thomas Morgan Pembroke, an internal medicine and palliative care provider at the University of Maryland St. Joseph Medical Center. Doctor, thanks for being with us.
It's a pleasure to be here. Thank you for having me.
We want to talk about advanced directives. When does that enter into your world providing care?
It's what I do on a day-to-day basis. Advanced directives are all about respecting an individual's wishes for medical care. It's what we hope to accomplish.
You hear different terms, living wills and so forth. Mm-hmm. From the provider's perspective, what do you want people to think about?
Well, I think there are two big things that we hope to accomplish with an advanced directive. The first is naming a surrogate decision maker in the event that one of our patients is not able to speak for himself or herself. We want to have next of kin available or a close friend who can help to make those difficult medical decisions. We also hope that people will have thought through some of what is to come in terms of their health and can help us, based on their own personal values and goals of health, to decide what the right course of action is for them.
One of the important things you touched on is that if the patient is still able to participate in their care, they participate in the care. That governs
Absolutely.
What you do, right?
Yeah, an awake and speaking patient is always our first line in terms of communication. The advanced directive really applies when an individual is so sick that they cannot directly communicate to the doctors.
When are there difficulties in your practice? If somebody doesn't have a document, hasn't thought ahead, what can happen that they might be unhappy with?
I think that the fear is that we will subject people to aggressive and burdensome interventions that they really didn't want. When we see people perhaps in the intensive care setting who are attached to lots of machines to prolong their life, it can cause a great deal of stress to the family, to the medical care team, wondering if the individual actually wanted these support measures.
What if somebody unfortunately winds up in that situation? Family members know that's not what they would have wanted, but they haven't done any paperwork. There's nothing legal to help.
There is a chain of surrogacy. There's Maryland law in place that can establish the next in line decision maker. I think most importantly, that is where palliative care can be helpful. We come in and talk as a group, as a team, to take some of the burden just off of the family and make it a group decision.
How do you define palliative care?
Palliative care is a medical specialty that helps people with serious illness and their families. We help to share information so that people are well informed about their illness and can make good decisions about their care. We help to manage symptoms so that comfort and quality of life are at the forefront. And we do advanced care planning, helping to fill out advanced directives and the like.
Do people maybe confuse it with hospice care?
All the time. And we get a great deal of fear when we walk into hospital rooms that people see us as a bit of a threat. We want to make sure that we're dispelling that myth. Palliative care is longitudinal. We see people for years at a time in some cases. Hospice is a very specialized type of care for people who are very, very sick and very close to the end of life.
Is this a growing field, and what made you choose it?
I I think my goal has always been to take the best care of patients possible, and I see this as the way that I can help to do that. It is a growing field. It is becoming more and more in demand as the baby boomers get older. We have more chronically sick people, more people hospitalized and in the intensive care setting. Our services are always in demand at the hospital.
Let me remind our viewers, if you have a question about advanced directives or palliative care, you can give us a call. We'll have the number up on the screen. You can also email your questions. The email address, livequestions@mpt.org. People who maybe don't have access to a lawyer, don't want to incur a huge expense, what are their alternatives for getting this taken care of?
My first recommendation would be that you speak with your doctor, your trusted doctor, either your primary care physician or your specialist. This is a medical legal form, but not something that necessarily a lawyer has to be involved with. The form is available through the Maryland Attorney General website. It's also available on the St. Joseph website for people who'd like to look the form over. I'd encourage you to look it over before you take it to your doctor to help get it filled out.
And the website at St. Joseph Medical is umstjoseph.org/advanced directive. You know, it's an interesting thing because it's something that potentially helps a lot of people. It potentially helps the patient, members of the family, and medical professionals. I mean, you're probably relieved when there's a clear set of instructions.
Absolutely. Again, first and foremost, our focus is on taking good care of the patient, but also of the family. Having an advance directive can really unburden your family from the responsibility of making these very difficult decisions. We don't want people left guessing what their loved ones would want.
And from a provider standpoint, and maybe this has changed over time, your instinct is to help and to do what you've been trained to do, which is to intervene. How do members of the medical profession feel about cases where the patient's telling you one thing and your judgment might be telling you something else?
Well, at those times where there may be some conflict of ideas, again, the patient's wishes are always respected most. But we sit and talk through. You know, there are always more than one way to address a particular medical issue. My job is not to convince people of my personal opinion or what I would pick, but to help them reach the decision that's best for them.
Let's take a phone call. Baltimore City, this is Linda. Linda, thanks for the call. Go ahead.
Yes, I'm calling to ask if you have a medical power of attorney, do you also need an advance directive?
Thank you very much. You're not a lawyer, but you play one on TV.
So, you know, if we're specifically talking about the Maryland form, there are two parts. The first part is naming healthcare power of attorney. The second part addresses some general scenarios that may, you know, chronic illness, persistent vegetative state, or coma, helping to talk through some of the possible things that we see frequently that may help to guide our decision making for that patient in the future.
Here's an email question from a viewer. Was going to have both children as decision makers. Is this a good or bad idea? That's a tough one if there's two. Who do you pick?
Man, I'll take two. We've had patients with as many as 10 children and no advance directive. Now in Maryland, it states that all children would have an equal say in that case. So I think it comes down to, you know, did the two children see eye to eye? Can they agree to follow your wishes? If the answer is yes, then it's absolutely fine to have both of them on there.
What are the toughest things, the biggest decisions, the most difficult decisions in filling out a form like that? If you were doing it, is there anything you personally would struggle with?
You know, that's an excellent question. I think doctors, having been on the front lines of treating people with chronic and serious illness, tend to feel pretty strongly about what their wishes would be. So I think I'd be pretty confident in filling my form out. I think the hardest part of getting these forms filled out is knowing how to start the discussion. So I think empowering patients to ask their primary care physicians and specialists about these forms, and letting them know it is not scary. This is not a scary process. This is an empowering process, and one that really helps your doctors make good decisions on your behalf.
You know, I should have looked up one of these to see what the questions, the current questions are. I sort of remember there being something about if you're in an irreversible situation, do you want artificial food, nutrition, hydration? I mean, is that a tough one?
It can be.
It depends on your age a little bit too, I guess.
We talk quite a bit about the benefit versus the burden of those artificial life support measures. And I think it's also an individual belief. There are religious components that come into it. Again, the advanced directive is a starting point for that discussion with patients and their family.
Let's take another call. Baltimore County, this is Ann. Ann, thanks for calling. Go ahead.
Hi, I'd like to know if a MOLST is as good as an advanced directive.
I missed that. If a what?
MOLST. It's MOLST.
She's asking about so MOLST stands for Maryland Orders for Life-Sustaining Treatment. It is the form that we would have you fill out if you came to the hospital in an emergency. We also use them in the community for select patients. It looks a little bit more like a menu than the advanced directive. It is specifically regarding CPR, life support measures, resuscitation measures, and some other common medical procedures that we would use in the hospital. It is a little more detailed than the advanced directive. The part that the MOLST is lacking is naming a healthcare agent. So it does not have that medical surrogate decision maker spot on it.
Is this necessarily something different than a do not resuscitate?
This form would include the do not resuscitate orders. There is more to it than that. There is a second page with some additional topics.
Okay, email question. What if you don't have family nor anyone close to trust? In that case, you're not designating someone, you're writing down your own wishes.
In that case, the advanced directive can still be very helpful. We would help you to document very detailed and specific wishes about your care so that those can be enacted on your behalf.
Another person writes, are there advanced directive forms, or are the advanced directive forms different for each state? Maryland versus D.C. Specifically.
They are. We've been speaking about the Maryland form because here we are in Maryland, but they are different state to state. Generally, they are honored across state lines, so if you fill out a Maryland form and happen to end up in a hospital in Pennsylvania, they'd be respected.
Yeah.
But we generally recommend that people fill out the form that is specific to their state.
Right. Let's take another call. Southern Maryland, this is Diane in Calvert County. Diane, thanks for calling. Go ahead.
My question is, how do you get EMTs and emergency room personnel to honor MOLST and advanced directives?
Great question. Thank you very much. Emergency situation, how do they know?
Yeah, I think they're really eager to respect patients' wishes, just as the doctors within the hospital are. What we tell people is, if you have filled out these forms, have them available. The emergency medical personnel are trained to look on your refrigerator. So we tell people to keep a copy of your MOLST or advanced directive magneted to your fridge, and they know to look there. Also, if you are a frequent over a specific hospital or hospital system, share your advanced directives and other wishes with your team there. Oftentimes with medical records, we have these things scanned into our medical record system at this point.
Is there like a medical alert bracelet that does the trick as well?
Certainly I've seen people with those. There are bracelets that say do not resuscitate and have other specific medical information on them. That's an option as well.
All right, let's check the email for another question. Oh, this is the same thing. How is this different from a MOLST? M-O, let's go through that again because I'd never heard of it. M-O-L-S-T, that's correct?
Maryland Orders for Life-Sustaining Treatment. Again, much more specific in terms of do not resuscitate orders and other life-sustaining measures, does not help to name a surrogate decision maker.
Okay, so if we can boil this down for viewers, what do you really need to have? And really at what age? Assuming somebody is in good health, Do they get one anyway, when they're your age or later on?
The right answer to your question is everybody over 18 should have had at least some conversation about this, and your physician should know who your next in line decision maker is. For most people, it's pretty straightforward. If you're 18, it's probably your parents. But again, anybody over 18 should look into this. People with chronic medical illnesses, people who have been to the hospital frequently in the past year, should absolutely look into the advance directive as a starting point.
What percentage of patients you see would you guess have something?
It's woefully low. Certainly less than half, probably less than 25% of people that we are seeing in the hospital have looked at this or filled it out.
So how often does somebody come along and you really wish they had taken care of this?
Every time I'm looking for it and it's not there.
Yeah. One more call, Prince George's County. This is Jack. Jack, thank you for the call. Go ahead.
Yes, if I happen to be admitted to a hospital, would a MOLT form override the advanced medical directive?
Whew, thank you very much.
Well, if you're in the hospital and awake and alert and able to speak to your doctors, then what you say overrides everything. A MOLST and an advance directive are not mutually exclusive. They work together. Again, the MOLST form has a few specific points that are more specific than the advance directive.
Yeah, here's an interesting point. This is the writer is a registered nurse. Once you're in a situation where you can no longer speak for yourself, your proxy must have the courage of your convictions, capitalized. It's got to be somebody who's going to do what you wanted done, not what they think you wanted done or what they want.
Yeah, I think very rarely do we feel people afraid to enact their loved one's wishes. I think quite the opposite. Having formally documented wishes unburdens people from having to make those difficult decisions.
Let me take another look at the website address for what you have online. It's umstjoseph.org/advance directive. You can also Google the website for the Maryland Attorney General's office. A good time to take care of this is not when you have to, but maybe right now because we've been talking about it.
Absolutely.
Doctor, thank you very much for your time.
Thank you.
Appreciate that. Thursday at this time on Your Money and Business, what consumers need to know to avoid financial complications from a hospital visit. And we will go behind the scenes of that recent launch of a rocket from Wallops Island, Virginia. Now, for all of us here at MPT, I'm Jeff Salkin. Thanks for watching and have a good night.
Your health segments are a co-production of Maryland Public Television and the University of Maryland Medical System.
This program was made by MPT to serve all of our diverse communities.